To many Ugandans, the word ambulance brings to mind a bicycle fitted with a chair on its carrier. Most emergency cases in rural areas are transported on bicycles or motorbikes. The few ambulances in the country are owned by public hospitals and other private health facilities. Some caretakers of patients in critical condition have had to seek alternative means of transport to save their patients from dying. Quite a number of ambulances in the country are four-wheel drive vehicles equipped with a few life-saving machines. But this situation is in stark contrast to Israel's national ambulance system. Uganda lawmakers recently toured Israel to learn about its success story. Israel has state-of-the-art ambulances that are managed by private organizations, outsourced, and others work in partnership with government.
Make sure that we respond to each and every call. We provide all the blood needs of the hospitals every day, meaning we have to collect enough blood donations.
Director of Planning in the Ministry of Health argues that both public and private organizations should partner with the government to make this policy proposal a reality.
We are already at an advanced stage at the Ministry of Health to design and introduce this proposal to government to start an independent Uganda National Ambulance Service. And we already have a consultant who is working with our team at the Ministry of Health to make sure the basic things are put in place before it goes to Cabinet and Parliament.
The chairperson of Parliament's Health Committee, Dr. Kenneth Omona, says the policy would be easily adopted if a national health scheme is in place.
If we successfully bring and pass the National Health Insurance Scheme, the insurance must be able to cover all the emergency services. If anybody needs care after the emergency services, then this now looks at, is now calculated from the benefit from the National Health Insurance Scheme.
An ideal ambulance has to have all the necessary equipment to sustain a person's life until one is taken to the hospital.
We have also a resuscitation kit for children and babies.
And when you can see all these ambulances, basically it's like a mobile clinic that can come to remote places and as well online to communicate with the doctor at the same time, because time is very, very important in saving life, which means you don't have to wait. The people will take maybe their own car, taxis, other vehicles that they have. They are losing no time. They are going to lose life.
In Uganda, a number of concerned citizens and politicians have bought ambulances that pale into insignificance when compared to the ones in Israel.
That we have ambulance crews, or that we have ambulances. Basically, these are patient vans that are scribbled on ambulance. Maybe when you go to big clinics like International Hospital, Nakasero Hospital, but all these small clinics, all these constituent vans where they write ambulances, basically they have picked some taxi drivers and given them some verbal instruction on what to do. Go and pick someone, bring him to the hospital, period. If a woman is delivering, I don't see any of these drivers stopping and giving some basic medical or midwifery services.
And we cannot do that without the modern technology of communication, training in terms of skills of paramedics, and then action required to save the lives of the victims.
Israel has taken its technological advances a notch higher by designing an ambulance that has sophisticated telecommunication facilities. It's said to be the first of its kind in the world.
We learn that everything should be mobile. So if you are responsible of the entire country, and this is your responsibility, you need to give the population your services whenever they need it, no matter what.
The designers of this ambulance say surgeons can carry out numerous tasks given its high-tech facilities. If the National Ambulance Scheme is introduced in Uganda, thousands of people in urgent need of medical attention may survive death. Maurice Ochol, NTV, Israel.